Hello, everybody. Welcome, all. Welcome to this month's Allied Healthcare webinar conducted by Health Tech Academy. My name is Ian Fuller. I am one of the leaders of the admissions department, and I will be your host this afternoon. And in this particular webinar, we will be covering all of your questions about the particular programs that you all are interested in. We will be going over all of the details of what Health Tech Academy has been doing up till now, what we stand for, what we're all about, and what the future holds for us alongside all of you. Um, let's give a few seconds to get everybody aligned. I see a lot of participants coming in right now as well. Welcome everybody. Let's give everybody 30 seconds to just settle themselves in. Uh, I'm sure you all, since you're here onto this Zoom webinar, you have a basic understanding of how Zoom operates, but you can definitely use the Q&A feature right there at the bottom to ask any particular questions that you will be having throughout the webinar. You should, I would recommend, type in your questions whenever they come to you, just in case you don't forget, but I will try and cover all of your questions right at the very end. That way, we can, take care of all of the information that we need to get out for all of you. And yeah, then we'll be able to take care of those as well. Just drop in the hi in the comment section, in the chat section, pardon me, so we know you are all ready to go. A nice meet and greet. Okay, perfect. We're getting that in right now. So for most of this webinar, I will be sharing my screen and we will go over everything step by step in detail. So just give me a moment to set that up. Right. So I'm sure you all can see my screen right about now. And right, let's just give it a moment to load properly. The webinar's time frame is going to be around about an hour. I'll try to keep it under time. Sometimes I get really excited and I go slightly above over time, but I'll try to keep it under the hour so it is within the time frame and it's as fruitful as it can be for all of you taking and attending the webinar. Let's start with a brief introduction for Health Tech Academy. We're based and headquartered in Austin, Texas, but we have a really diverse team. Most of our staff is based out of the headquarters, but we have a lot of employees also based out of the East Coast, some in the West Coast in California. We have a lot of our team members also globally based, some in Asia. We have a couple of people from Africa. We also have a couple of people in the Far East. So we're really proud of the fact that we are, multi-ethnic and we're operating from around the globe. The team itself is bringing in approximately 25 to 27 years of experience in the edtech space and 15 plus years specifically in the healthcare experience sector, right? So that is a little bit about our particular experiences. We have about, I would say, 22 to 24 coaches as of right now. And each coach that we employ in order to facilitate our students has 10 years plus of experience. That is our minimum requirement. So these are people at the top of their fields, experienced, seasoned professionals who not only will be able to cater to all of your questions in the programs, but also act as mentors for each and every one of you. And that is also something that is that we really take pride in. Active students currently are around about 24 to 25, around about that range. And we're bringing in close to 200 now, in fact, students on a month-to-month basis as well. Right, we've covered the Q&A feature, and right at the end of the webinar, we will also be announcing the tuition deals and discounts for all of the attendees. I'm sure a lot of you are going to be really interested in that, so do stick around for that at the very end. So the table of contents as to what we're going to be covering today, we'll talk about Health Tech Academy in slightly more detail. We'll talk about the future of allied healthcare from our lens, from as we see, and we will then go into all of the details of our popular boot camps. In fact, I think I will cover each and every one of them so that if any of you is interested in them, they'll have a really good understanding and a really good idea as to whether that particular program is a good fit for you and how you're supposed to go about it, right? We'll go over the admissions process. That's my forte. That's something me and my team take care of. So I'll go over that process with you as well. We'll talk about the financing options that we have as part of the program, what career services we offer, which is, I think, one of the most important parts of our program for most of our students. We'll look at some student testimonials and right at the end, the Q&A. Let's talk about who we are and what we do. So we are a leader in flexible and accessible online training for the past 20 years. And we build programs around the growing areas of the allied healthcare sector, right? Um, there are plenty of areas that come up with, obviously, with the integration of new technologies. So our focus is always to be the first to launch specific career paths, specific educations for all of those sectors. And obviously, a lot of these fields are evergreen, such as surgical technologies, such as medical assistance. So we always try to keep on refining those programs to keep them industry aligned as well. Headquartered out of Austin, we've covered that. And Our focus has particularly been on excellence, innovation, and personalized learning. uh, the flexible format that we operate in, right? It's completely online and it's self-paced and it's tailored to seamlessly fit into your schedule. And that's something that I particularly really like for the students because we have students coming in from different walks of life, from different areas of expertise, and from different stages in their careers and in different ages, right? In different age brackets. So the fact that you can choose to do the program or take this education according to your own schedule is a huge benefit, and it basically helps each individual taking the program. And not to say that it's not going to be tailor made for you or your questions won't be answered. There are so many different features. We'll cover all of them very shortly that you would be able to take advantage from that. It's I would say even better than the live class format that a lot of you might be more familiar with. We collaborate with different universities and employers, and basically to make sure that the boot camps that we're offering are completely aligned with today's industry. And yeah, one talent at a time is what we like to say, tell ourselves, and that's what we try to produce. I'm going to read our vision for you as well. The Health Tech Academy aspires to transform and innovate the way healthcare professionals are educated, hired, and retained. You can briefly read our mission statement as well, right over here. Some of these points might be slightly repetitive, but I'm going to try and keep it, as streamlined as possible. I just want to make sure that everything is properly conveyed and you have a really good understanding, especially of the things that we are really excited about, right? With that, um, the program, once again, is completely designed to stay up to your schedule, fit your schedule, and meet your desired needs. A lot of my students who are coming in are working double shifts, right? We also have working mothers taking the program, so they don't have a lot of time to, spend on a daily basis on this education. So for them, spending time after work or before the children wake up, or if they want to cover it up over the weekends, or if they want to take a break for the entire week, they have that flexibility, right? The support is going to be there with them. I usually like to tell my students is that our job is to facilitate, is to motivate, and to give you all of the facilities you would need in order to achieve your target, right? And the rest and the timeline, the drive, that is you, right? That is purely you. um, the three key aspects of our program are on demand, self-paced education, and one-on-one coaching. One-on-one coaching is very, very imperative for most of our students. Um, it gives you, the advantage of having the instructor all to yourselves at that time. So all of your questions are answered at that particular time, right? And that really helps save your time. And then the instructor then can obviously focus all of his efforts in that particular time slot to you, and even mentor you, give you guidelines, give you further steps and over and above steps sometimes that you can take in order to be successful into the industry. And a lot of the students really take mentorship from them, form, some of the students even form lifelong bonds with the instructors, with their mentorship, and they can take advantage of them in the years to come. So that is just a little bit about how our boot camps work. Again, these are some of our partners that we are affiliated with and work with very closely. You can see some of the accreditation bodies that provide the programs and provide the boot camps, such as the HSPA is going to be providing the sterile processing program. The National Health Career Association provides a lot of different certifications. We use their certifications for medical assistant, for EKG, and for various other programs as well. The NCCT is, we're affiliated with and give and provide the surgical tech course, the TSC certification. We'll cover that very shortly, and some of our university partners here as well. So the program flexibility, I'm just going to tie a little bit more into that, is that it's designed for a wider range of experience levels, and people with limited or no healthcare experience as well are easily fit into the program. We have, I would say, most of our certifications are entry level friendly. Meaning that even if you are coming in with little to no experience in the allied healthcare sector, you would be able to, get take the particular courses, and with the help of our career services, find a paid opportunity, all within the time frame that we provide, right? And then we also have a few intermediate to advanced level certifications for students looking to upskill themselves in the particular desired field, and look for better paying opportunities and for promotions, obviously. So that is also something that we are able to provide with that particular flexibility. Everybody can take our programs from the comfort of their own homes, from the comfort of their living rooms, wherever they choose to take the program, they would be able to do so. No relocation is required. There will be some programs which will have some requirements for clinicals, and we'll circle back to that. But for those particular certifications, you would obviously be needing to go to a physical location to complete those clinical hours or clinical cases in some particular programs. And so the career services team helps you and aids you in finding those clinical sites as well. So that's something that we do for all of the students. And once again, the program completely online, completely self-paced. Let's now talk about the future of allied healthcare as we see it at Health Tech Academy. Now, in 2025, the allied healthcare roles, just like the previous years, have been hugely in demand, right? A lot of the students, when I'm speaking to them on calls or sometimes on texts, have a really valid concern, I would say, as to whether these fields that they're applying for will still be in need or still have the same importance in 5 years time or 7 years time or perhaps even after a decade. And my answer to each of those students is always that with the introduction of artificial intelligence, you will never be losing work, but your efficiency for that particular role with the new technologies will increase. So whether you were catering to, let's say, 20, 25 patients in one day, as an example, at the top of my head, you'll be able to cater to perhaps double, around about 50, right? With the integration of intraoperative imaging in surgical technology. Or for medical assistants, there's now a lot of electronic health record managements. So not everything needs to be, manually done or manually typed. A lot of it is, done through AI. For stellar processing, there are, some automatic sterilization equipments that are now possible, right? So a lot of the roles will then transition into us as allied healthcare professionals monitoring these particular technologies to a certain degree, right? So the best way to get or catch this wave of artificial intelligence or this wave of new technologies is to get your foot into the industry at whatever level that you're looking at, right? And then obviously you will need to upskill yourselves according to the industry at the correct times, take more particular trainings, take more particular certifications, look at these new technologies coming in, request your employers for more, I would say, refined knowledge about them, refined coaching regarding operating these particular, uh, you know, um, mm, new technologies, and then obviously that would help you elevate and grow into the industry. So the future of allied healthcare, as we see it, is very safe, and it will continue to grow for the foreseeable future. We'll now get to our most popular programs. I'm going to take a lot of time here, try to explain how the programs work, and let's just get right into it. Surgical technology is one of our, I would say, most popular programs. A lot of our students want to take this particular certification. We provide the TSC certification by the NCCT. The NCCT is the National Center for Competency Testing. As you saw a little bit earlier, we're officially affiliated with them, and the TSC stands for the Tech in Surgery Certification. This particular certification is a minimum requirement in order to get an industry aligned role of a surgical technologist, right? And so it has, we'll cover the entire duration, the certification, everything related to the certification and the offerings that we are able to provide in order to facilitate you achieving this particular certification, right? So uh, this program, and in fact, all of our programs are completely self-paced, as I'm sure you've heard. But we do have a time frame associated with it, which is 16 weeks. Now, this is an average time that we give to the students while speaking to them. If the student is able to give the program and the education roughly 12 to 15 hours, or sometimes 18 hours per week, right? Then they would be able to complete the program within 16 weeks or 4 months. The course access for this particular program, as it is for most of our programs, is going to be for one entire year. So within the 1 year period, you can basically do the program as quickly as you want to, or you can, take your sweet time in completing the program. The 16 weeks is the average amount my students spend on the education part of the program. Now, surgical technology is one of those particular programs that has a clinical requirement, meaning in order to become a certified surgical technologist by the NCCT, you need to accomplish two things. You need to pass an examination, which is the TSC examination that you'll be preparing for within the 16 weeks. And after you have completed that, you will be required to complete 125 surgical cases of clinicals. This roughly takes roundabout, I would say, between 2 to 5 months for most students. Now, this would obviously depend on the hospital picking you up. This would depend on the hours that you were able to put in yourself. So there are a lot of moving parts to this, which is why the time frame is a little lengthy. But that is what you should have at the back of your mind. 4 months roughly to complete the education. It takes a couple of months for our career services team to find you a clinical site within your particular area to complete the cases. And then obviously it would take another couple of months for you to finish the certifications, pardon me, finish the clinical cases. And once you meet both of these requirements, the NCCT does a brief check on if everything is aligned. And Once they're able to do that, they will be able to give you the certification, and then we even assist you getting a placement in different in sites near to you, right? The total cost of this particular program is now at 3950. There will be discounts, as I've mentioned earlier, for the webinar attendees, and that will come to right at the end. Now, this 3950 is not necessarily something you need to pay upfront. If you are able to pay upfront, we usually offer some discount to the students, and some some special features as well are added to that. Students are also given the option to pay a monthly interest-free payment plan with an interest-free monthly payment plan, or even with student financing. We offer all three services, or all three different methods of payment for the suitable candidates going for each of those. The eligibility for this particular program is that you need to have a basic high school diploma or GED. You need to have a stable internet connection, and a laptop or PC is ideal for taking the program. It's much easier to navigate the platform with a particular laptop or PC. And one thing that we need to address is that the surgical technologist certification is not for beginners. So it's not something that you can just start off with within the industry. It is something you should have prior experience within the allied healthcare sector before attempting, right? So this is, I would say, an intermediate level certification. With prior experience, it becomes a lot easier for you to find a clinical site, to find work. And so my recommendation is always do this program after you have already stepped into the industry. Let's talk quickly about the offerings that we are able to provide within the program. So, self-paced education, once again, is that you will have an online platform. I will give you a demo of the live platform very shortly. And on the online platform, you basically will be able to view your video lectures. Step-by-step video lectures have been created for you on each topic of the curriculum. They are very interactive. You can ask questions right there, and we have a couple of features with artificial intelligence added recently, where they will be able to answer your questions. You have a student support section connecting to other students who are watching the videos and taking the program alongside you. You can obviously book your one-on-one session right there on the platform. I'll show you how to do that in that particular section as well. And along with that, there are some other very key features we've recently added, such as a job portal where you can look at real life statistics of the jobs that are currently available within your area, and what the average salaries are, and so on and so forth. And within this particular certification and this particular price, you also are able to get a certification preparation for that particular uh, program, and you also the actual examination for the NCCT CSE is added into the program. So there are no additional costs or additional fees, I would say, and everything is included from your registration, from the online platform, from your coaching sessions to the career service representation, the transcript, the works is all added within this pricing, right? Um, Ebooks are also obviously a huge part of the program. Your ebooks and your video lectures are your primary mode of learning, and then obviously we supplement that with quizzes and the other features that we're able to add onto the platform as well. Skill videos we recently added as well to the program, which will help you get a better understanding as to what perhaps other skills you may require in order to do this job role at a really good level, or a successful level, right? The exam voucher and externship support are added into the program. One thing of importance you guys need to note is that there are a few restricted states. What restricted states exactly means is that the NCCT is able to meet the requirements for, I would say, most states, but there are some states who have some additional requirements, meaning apart from the TSC certification, you may need to do a few other steps. You may need to register at a couple of other places in some states, and for some states, they prefer a different certification body, right? So you can look at those particular restricted states. I'm going to have one of my team members put a link to the website, and you can check, you can click on your particular state right over there, and it'll give you a list of whether that particular state is approved for the NCCT TSC certification or not, and for the rest of the programs as well, right? So that is all about surgical technology. Let's move on to medical assisting. The medical assistant program we have is again around about the same time frame at 16 weeks, but we know the drill. It's completely self-paced, and you get to choose and pick your own hours. The course access you will get is for 1 year. The certification we are preparing you for is the CCMA, the Certified Clinical Medical Assistant, and the examination body is called the National Health Career Association, the NHA for short. Right. There are two separate packages we have for this particular program, and and one being the basic package of 1250, and one being a max tuition option of 1990. We call it the max because we've added a few extra features to this particular program. This is one of those programs that is more moderately priced, and this is an entry level friendly certification. So a lot of my students just stepping into the industry get the recommendation from me to join the CCMA program or the medical assistant program, because this gets you a really good it gets you to step into the industry. There are a lot of jobs in every state for this particular program, and just with a couple of years of experience you can transition into a lot of other various areas in the allied healthcare sector. The eligibility is going to be the same, being the high school diploma or GED, and the stable internet connection is going to be imperative for you to take the program. The offerings for the basic program are going to be that you will get all of your online platform and the online education. You will get your career services, meaning the career services will help you get a paid opportunity after the program. Your books and your skill videos are going to be added to the program as well. Right. With the max tuition option of 1990, you basically get to add the exam voucher and the one-on-one coaching session. You might be confused as to why we've kept this separate, but we had a lot of demand from a lot of our partners for a basic package for those particular individuals who are already mostly working at hospitals and they want to transition into medical assisting. So for those particular students, they would not need the voucher, as their company or their hospital usually pays for them, and they already have coaches available at their own hospital. So this is why we've kept this at a two-stage or a two-step different package plan, right? There are a few restricted websites, a few restricted states you can check on the websites. Now let's look at the patient care technician program. Again, this is going to be priced at $34.50. In fact, for this particular program, do ask your advisors about the discounts on offer. The payment plans are starting from $266 if you're going on a monthly basis. The CPCT is the certification you're preparing for by the NHA once again, and this is a 16-week long course. Just like the medical assistant and the search tech programs, the same eligibility requirements for this particular program. The offerings are pretty much the same as your search tech, and there are no particular clinical requirements for the patient care technician program. And in fact, even for the medical assistant program, the CCMA, there are no clinical requirements, meaning right after taking the certification and getting it under your belt, you can apply for paid positions within that particular field, right? The offerings, once again, are pretty much the same. You will get your online platform, you will get your one-on-one coaching sessions, you will get your skill videos, your books, your exam voucher, the certificate preparation, the career support is all added. There are a few restricted states, and you can check that on the website. As for the pharmacy technician program, we have two separate pharmacy technician programs, and let me open both of them and give you an idea. So we call the first one the pharmacy technician program and the second one the pharmacy technician professional. There is a difference of, I would say, the certification that we're able to offer for both of these programs. Otherwise, the programs are very similar. And the reason we've kept them separate is because the restricted states for this particular program with the NHA are going to be slightly more, which is why we've added the pharmacy technician professional so that we can have more students from different states. Depending on their state, they can choose which particular certification is more valuable in their area or valid in their area for the, and they can choose which particular program they want to go with, right? It's a 16-week long course, such as the rest of the programs. The CPHT is the one by NHA. 3450 is the total cost of the program. The discounts you can ask your advisors about. Monthly pay starting from 266. The same eligibility requirements being high school diploma and GED, stable internet connection, and the same offerings such as the previous programs that we've just looked at. And there are, again, some restricted states for this. You can check out on the particular link that we've added onto the chat. The dental assistant program, the RDA by the AMT, is again a 16-week long program. This particular certification we've noticed has a really high success rate when it comes to finding jobs. Not to say that other people or other programs are not able to find jobs, but for because of a huge demand of dental assistants, I would say a lot of our students are handpicked, or I would say readily getting jobs right after completing the program. Again, 16 weeks, the full tuition being 3450, and you can ask your advisor about the discounts on offer. Monthly pay starting from 266. Same eligibility, the same offerings, few restricted states you can check on the website. Stellar processing is now the second program on our list so far, which has a clinical component attached to it. So for this particular certification, which is called the CRCST by the HSPA, you have to, after completing your exam, also go or complete 400 hours of clinicals, meaning that you have to complete these 400 hours of clinical cases in order to achieve your certification and get a position or a paid opportunity. This is entry level friendly for the most part, I would say. People without any prior experience are easily able to study this particular program and even get opportunities after that with the assistance of our career service representatives. 16 weeks roughly is how long most students take. The full tuition being 3450. You can talk to your advisor about the discounts, same eligibility requirements. The offerings are going to be pretty much the same with the one-on-one coachings, with the exam preparation and career support we offer, with the books and skill videos, everything attached. There are for this program no restricted states, meaning that the CRCST is valid throughout the country. Phlebotomy now is the third program on the list, which has a clinical requirement. The clinical requirement is going to be very simple for phlebotomy. It is just 30 one-punches and 10 capillary sticks, if I remember correctly. And this can be achieved in hopefully a week or so. So it's a very short clinical requirement. This program is also slightly shorter, being that it is only at 12 weeks on an average for most students. And the certification is called the Certified Phlebotomy Technician, or the CPT for short. The full tuition is going to be in the $2,000 bracket, and you can talk to your advisor about the particular discounts. Same eligibility requirements as the rest of our programs, and the offerings are going to be pretty much the same, with the exception, obviously, of the career support, who will first help you get a clinical site and then offer you the option for the paid opportunities as well. There are a few restricted states you can check on the website. We will now be looking at the medical coding program as well. I think my camera is giving me a little bit of trouble. Just give me a moment. Right. So the medical coding program that we have, in fact, I think I will open the medical billing and coding first, and then talk to you about the medical coding program as well. So for the medical billing and coding program, this is the more entry-level friendly program. The jobs that you can get right after this are more towards the billing side rather than the coding side. But to step into the industry, that is what needs to be done, right? You need to get job roles which are more aligned towards the billing side, and then obviously you can transition over into the coding side. The CBCS is the certification by the NHA you're preparing for. It roughly is going to take 3 months to complete, but obviously you can take your sweet time in completing it, or as quickly as you need to. $3,450 being the total cost of this program. $266 is where your monthly plans start off with. Same eligibility, same offerings, and a few restricted states. Once done with this particular program, we get a lot of people or a lot of students who then want to go for the medical coding program as well, right? And This is, I would say, the more intermediate level certification. And whether you and once you're in a job role of a biller or a coder, this is the certification that really helps you upskill yourself and get to better paying positions. This is 14 weeks roughly, and this is again going to be priced at 3450. Ask your advisors about the discounts, same eligibility and offerings, and a few restricted states you can check out. The healthcare IT program that we have is similarly priced to the Search Tech program at 3950. This particular program or bootcamp is preparing you for two certifications: the ITF Plus by CompTIA and the CEHRS by the NHA, or the Certified Electronic Health Record Specialist by the NHA. Both of these certifications, I would say, are very, very important in acquiring an IT role in healthcare. And so we're going to be preparing you and giving you the information for both of these certifications, as well as booking both of these exams for you at with this particular program, right? It's roughly going to take you 16 weeks or 4 months to complete the education. And then obviously you can go on and give the exams, same eligibility and offerings, and I think a few restricted websites a few restricted states as well. Now, if you want to go for something more basic and not directly jump into IT, you can just go for the CHRS by the NHA or the Medical Health Record Specialist. This is somewhere usually people like to start off with. This again is going to be 12 weeks and priced at the $2,000 bracket for the program. And you can basically start your payments at 141 on a monthly basis. The eligibility is the same. The offerings are going to be the same. A few restricted websites you can check out. Uh, the EKG program is something is I think the last program on our list which has a clinical component tied to it, and it is also very short. Just like phlebotomy, you just need to complete 10 live EKGs on a patient in order to get or release your certification, after obviously clearing your exam as well. So this is, I think, one of the shortest courses we have at an average of 8 weeks or 2 months for most students to complete the program. It's priced at the $2,000 bracket, and the eligibility is the same. Now, the career service representation is going to help you first within your area look for a clinical site to provide you those 10 EKGs. Obviously, can be completed within less than a week in most cases. And once you're able to do that, you can get your license for the CET and easily find work with the uh, guidance from our counselors. A few restricted sites you guys can check out. The healthcare leadership program, I think, is the last program I'm going to talk about. This is an in-house certification, so there is no external body verifying this particular certification. But this is one of our projects that we've designed for students who are looking to upskill themselves, become better team players, or perhaps look for better or management roles into the healthcare sector. So we've meticulously created this. It's roughly takes 12 weeks or 3 months to complete. It's priced at $39.50, and you can talk to your advisors about the discounts. We will give you a Health Tech Academy certification for this particular program, and you will get all of the support that you need in order to upskill yourself and look for better paying positions after this. A lot of team members are also taking this particular certification to become better team players, because obviously if you learn leadership skills, you not only are a good leader, but also a really good team member and a team player as well. So that is something you can definitely consider after doing perhaps your primary program with us. There are no restricted states again for for this program, because this is in-house and this is a certification we're able to provide ourselves. That was all about our certifications and the programs that we offer. So let's quickly get into a demo of the learning platform. So I have a test account open. Let's see if it's right there. Yeah, it's operational. So this is what basically the online platform that we provide to the students looks like. Now this once again is a test account, meaning that it has a lot of boot camps tied to it, and it's something that we keep on tweaking and testing. So let me just briefly go over it. Over here on the left hand side, you will see all of these particular toggle buttons where you can view the bootcamp that you're doing, how many coaching sessions that you have remaining, and who the coaches are. You can look at your particular profile because you will be required to create a small profile for this particular platform. Your analytics and your progress reports, meaning how much time you spend on the program, what are the numbers that you've gotten in each quiz, and stuff like all of the metrics as to the time associated spent on each program and the course are all going to be given to you right over here. Some basic documents that you will need are going to be right on this section. There is a refer and earn reward, meaning that if any of your friends or family or colleagues are interested in taking any healthcare related courses, and if you can refer them, there is a bonus in for you as well. You can talk to your advisors about that in more detail. We have recently, as I mentioned, integrated AI into the platform, and that is skill set AI as well as practice with Alexa. This gives you a lot of tools when it comes to either asking your questions, looking for different ways to strategize your CV, your resumes, and there are a lot of other features added to this as well. Let's quickly take a tour of how the boot camps are going to go. Let's go with the stellar processing program, I think is what I want to show you guys right over here. This pop-up is always going to come up for you to complete your profile right over there. So that's something that you can do complete later, or once you join the program, obviously you can create that small profile for yourselves. This is what the platform is going to look like. And now this particular feature we've recently added as well to give you an understanding of what the career outlook and job data is within your particular area and how many job opportunities are currently available. So once you click on this section, it'll give you all of our programs, meaning let's just go with the stellar processing since that's what we're looking at. Let's look at Virginia as an example right now. We can see that we are, let's say, at an intermediate level, and it'll give us an outlook as to what the average salary is for intermediate level professionals, how many job openings there are that you can actually open up right over here by clicking there, what the the growth rate and the outlook is all going to look like. And then once again, you can look at your particular courses as well. So again, this is a test account, which sometimes takes a little longer. Right. So here are your courses that you are required to do. All of them are going to be right over here. And then obviously, once you click on this particular button, it'll take you to your first lecture. And then within your first lecture, you will have your discussions. I always recommend our students to enter the theater mode. It makes things a lot easier. And then obviously, all of the slides and everything that you will need, the discussion for them is all going to be right over here, including the video and then the course exam right at the end of each particular module as well. Some of them are going to be slides, most of them are going to be videos, and that is how you're going to be going through the entire program. So that is going to be it for the demo. Let's get back to our presentation. Right, I think we skipped a few things, but yeah, there it is. Our demo is right over there. And let's now talk about the admissions process. The admissions process is very, very simple. Okay, I think we're having a little bit of difficulty with this. Just give me a moment to get back to it. Right, so let's talk about the admissions process that you all have possibly gone through or will be going through very, very shortly. And it's very, very simple, right? So whenever you put in an inquiry, it's either me or one of my colleagues who attends your calls, your messages, your live chats on the website, and we're able to give you the step-by-step process to what the admissions requires you to complete, the paperwork you'll need to go through. We'll explain the program to you in detail. We'll answer all of your questions. We'll help you out. Set your profile, talk to you about career services, and anything that you would need in order to reach your decision. We're usually very cooperative, and we're able to help out with that, right? And the process to get started is very simple. Whether you're going for your upfront payment discounted fee, whether you're going for a payment plan or a student financing option, as soon as you're able to clear the first invoice or your paperwork, you can start your program within 24 to 48 hours. Meaning that's as long as we take for you to get started with the education and the online classes. There are a few class start dates for some programs, meaning that in order to align you with the other students and the instructors, there are some class start dates, but obviously you can start your self-paced at any given time. Now, when it comes to paying for the program or the financing options, the upfront payment options are usually associated, or we associate some substantial discounts if the student is willing to pay upfront, and we often offer them some additional gadgets, just to help the students out as well. And there will be some separate discounts for the webinar attendees as well, as you will see very, very shortly. There are monthly installment plans that are available. Some of our financing partners being Ascent, Fortify, Edley, work with student financing. And then again, you have the 12-month interest-free in-house payment plans for each of our programs as well. There's also a study now, pay later option with the firm. And if you use a firm, I think this is the perfect way to get started, where you can just start the program without paying for anything. And then once you're able to get out of the program, possibly land a job, is when your payments actually start. So that is something you guys can do as well. Let's dive into career services, right? Now, career services for this particular program, or for all of our particular programs, are very important, meaning that the objective is not complete, or our vision has not completely taken place until and unless our student get paid opportunities. That is our objective. That is what we strive for and desire for each and every one of you who's going to be attending our program. And we do everything that we can, whether it is working on your resume, whether it is working with you one-on-one with your soft skills, your interview skills, whether it is teaching you to connect with different employers, what questions you should be asking if you connect with an HR on call, whether if you connect with a recruiter on call, if you're emailing them, what is the best verbiage you're supposed to be using. We'll provide you with some templates and some really key strategies on how you're supposed to communicate with them. We commit to finding all of our students paid opportunities and internships or externships for those particular programs. We don't promise to hand you the fish, but we will definitely help you learn to catch the fish, being the analogy that we like to use for a lot of the students. Um, Networking goes a really, really long way into finding paid opportunities. So LinkedIn optimization is also the utmost priority for our career service representation for each and every one of you. These are some of the other features that we've added, along with the AI features that we've added to the career services. So we have now simulated job interviews that you guys can conduct. The skill videos that I was talking about are also integrated there, meaning the other skills that perhaps will help you perform this job role a lot better will be given to you in these particular videos. Your resume is also looked at by our representatives, and then we also have AI powered resume builders for you to take assistance from, application assistance, progress reports, as well as one-on-one coaching is all added to the career services. These are some of the student testimonials I would love for you guys to read. On Trustpilot, we have a really high rating. I'm sure that there are just a few students with, who've gone 4 or under, but mostly we get the 5 stars, and we're able to keep the students satisfied as part of their education and their tenure with us. I'll give you guys a few seconds just to read on this as well. And just so you know, you will be getting a copy of this particular webinar. So just in case you have missed anything, or just in case something was left out, or that you didn't listen to or couldn't understand, you can definitely replay it, and you would possibly get your answers right over there. I also would like to uh, open up a student testimonial video, just one of them, so that you guys can get an understanding. Just give me a moment to load. Mhm. This is taking slightly longer than expected, so let's just get back to it, and let's cover the next part. So this is the time that I would love to answer all of your questions. So let's get into the Q&A right now. But before we do, I'm gonna share this particular screen and open the special webinar discount for each and every one of you. This you can, even scan the QR codes, and basically all of the attendees for this particular webinar are getting a flat 30% off if they go for the surgical tech program, or the any of the other 3950 programs, with a free laptop. That's what we've had in store for the webinar attendees. If you are going for the medical assistant program, you get a flat 63% off, which is very substantial, and a flat $1,000 rate for all of you. For the programs priced at 2,000, such as EKG, phlebotomy, and others, you will be getting a 20% off, meaning you can pay 1,600 with a free laptop for those particular programs as well. You guys can, mention all of your questions right here, right now, and I'll be able to take care of them. I'll leave the screen here for just a moment. I'm sure you've all spoken or have had a connection with an admission advisor. Just in case you've not, you can scan this QR code and you will be redirected to one. You can visit the website once again. And if you are unsure after all of this information as to which career path would be the best fit for you, you can perhaps take our career assessment quiz. It's a very short quiz that will give you a really good understanding of perhaps where you would be the best fit in the allied healthcare sector. And with that, we will come back to the Q&A. So I'm going to go over the website, the webinar chat, as well as the Q&A. All right, so you guys can type in your questions and I'm right here for you. We still have a few minutes left, and I'll be able to, go over all of them in detail with you. Right. So can you elaborate more on the relevant healthcare field experience for surgical tech? I'm interested in the program and I'm currently a CNA, of course. So Ms. Hall, if we want to go more towards the surgical tech side and the experience you would need, uh, the reason we recommend that the students have at least an year's worth of experience interacting with patients or working in a role that has required them to work alongside patients is because getting clinical sites, which is a requirement to complete your certification, is really difficult, or hospitals are unwilling to take those particular students who don't have an experience dealing with patients, right? So my recommendation is join this particular program. Even if you have 6 months of experience dealing with patients, whether it's a CNA such as yourself, or the medical assistant, or some other particular role, you were good to start this program, because obviously the program itself is going to take a little long to complete. And so the clinical sites or the hospital would easily be able to offer you the clinical placement, and we would have an easy transition for you to get from CNA to surgical technology. So that is, I think, at least 1 year or 6 months at the very least experience working with patients. Are there additional discounts for those who take multiple programs at a time, such as surgical tech and EKG? Most definitely. You can speak to your specific admission advisor, Ryan, about taking multiple certifications. We do have some bundle programs, meaning that a lot of the programs we have, fit seamlessly into each other. I'll give you one small example, being medical assistant, EKG, and phlebotomy. Oftentimes in smaller clinics, or if you're going for job roles at hospitals, a medical assistant may be required to do the job role of a phlebotomist, right? So for students who come to me just for medical assistant, I often tell them that yes, that's wonderful that you're thinking about medical assistant now, but also think about 6 months or 8 months from now, or perhaps even a year from now, right? Where your job role might require you to do phlebotomy. So it's better you take a bundle program with a discount, so that way you're saving money and you're able to get your education out of the way right off the bat. So that is something you guys can definitely do. Talk to your admission advisor about that, Ryan. He will be able to help you, or she will be able to help you out. um, are the pharmacy tech, dental assistant, or EKG tech courses considered entry level or intermediate? Very good question. Um, Pharmacy tech and dental assistant can definitely be entry level, meaning that if you have little to no experience with just those certifications, you should be able to get a paid position. For EKG, and I would tie phlebotomy into this as well, if you directly get into this particular job role, yes, you would be able to find paid positions, but it's always better to do the bundle programs, meaning it's always better to do the medical assistant master with all three certifications. So whichever employer is picking you up, they have the away, or they would be more likely to pick you up if you have that flexibility where they can use you in whichever area that is most needed, or perhaps interchange, or perhaps use you in different job roles at the same time with better pay, of course. So that is my recommendation to you, Nicole. I have completed payment. When am I able to start the program? So basically, once you complete your enrollment fee or your upfront fee, uh, one of the admission advisors or one of my colleagues or me, I would be able to process your paperwork. That just takes me a couple of hours. You will be getting an orientation video to give you a really good understanding of how to use the platform, the online platform, effectively. And with that, you will then get a financial agreement, or a few paperwork, or a few documents to sign. And right after that, you will be able to get your login credentials that we will create and send to you via email. All of this process after completing your payment should take no longer than 24 to 48 hours. So that is the time frame we give. Oftentimes it'll be the very same day, right? Oftentimes it'll be like, you've made your payment in the morning, and by day end, you will have course access, but we still provide you a time frame of 24 to 48 hours, just to be on the safe side, and just so everybody's expectations are met. I have another question from Fatima. She mentions, could you could someone kindly give us the code for the medical assistant program? Of course, I will leave that particular code for you. And Fatima, just in case the code doesn't work, or if there's any other issue, you can easily just speak to your admission advisor, and they would be able to offer you that particular discount. You can tell them you were a webinar attendee. Once they verify it, you'll be able to get that discount. Nothing to worry about. I'm currently a paramedic who is already reads EKGs. Is there a way to test out the EKG program? Hmm. Uh, I would suggest, Ryan, that we can definitely give you a tour of the particular EKG program, or the better thing I think for you to do would be to read the detailed EKG syllabus we have, that you can easily download from the website, or speak to your admission advisor about it. They would be able to provide it to you. But we can definitely arrange for like a brief tour for you as well, for you to go over some of the details of the program, speak to your admission advisor. And in fact, if one of my colleagues can note down Mr. Ryan, and we can take care of his particular request as well. And we can see if we can accommodate him uh, within this week. That is all of the questions I have from you guys. It was wonderful, to answer all of your questions, to host this webinar, to give you guys all of the information that you came here for. I hope and I pray that this was informative and fruitful for you guys. I hope that the allied healthcare sector is something that you're looking into. For most people, it is a career change. For some people, this is uh, for them to upskill themselves, get better paid positions. We really take pride in our work. We really want to help you guys out. Connect with us with any other questions that you have, or if we've left, and we will be able to take care of you and answer them for you. It was wonderful having you guys around. I will hopefully see you in an admissions call very, very shortly. Take care of yourselves and your loved ones. Have a wonderful rest of your day. Uh, uh, Take care. Goodbye.